HIV, or human immunodeficiency virus, is a blood-borne virus typically transmitted via sexual intercourse, shared intravenous drug paraphernalia, and mother-to-child transmission, which can occur during the birth process or during breastfeeding. HIV disease is caused by infection with the HIV-1 or HIV-2 virus. HIV produces cellular immune deficiency characterized by the depletion of helper T lymphocytes, otherwise known as CD4 cells. The loss of CD4 cells results in immunodeficiency and the development of opportunistic infections and neoplastic processes. If you've downloaded your PowerPoint slides, or better yet, just pull them up onto your screen from the PowerPoint, from the Blackboard format. If you open up the slide here that says Life Cycle of HIV in the slideshow aspect of your PowerPoint presentation, you'll be able to click on this HIV life cycle link that will take you to a YouTube video that will better describe how the virus invades the CD4 cell, how it gets its RNA transcripted into the cell's DNA, and then replicates itself within that CD4 cell and eventually causes the CD4 cell to be destroyed, and for millions of HIV viruses to be interspersed in the circulation, and those the CD4 cells that are currently circulating then become infected with the HIV virus. Transmission of HIV. On this slide, you'll see the 3 highest risks for becoming infected with the HIV virus. These include having unprotected sex, oral, vaginal, or anal, with an HIV positive person. The highest incidence or new incidence of HIV occurs still with men having sexual intercourse with men, even though there are many other ways of transmitting HIV. That's basically still the highest reason for people contracting HIV. Other risk factors are sharing needles and syringes with an HIV-infected person, maternal fetal exposure, and then other possible risks, as you've probably seen in your reading, are tattoos, body piercings, and the receiving of blood products. Cultural considerations in the increase in incidence of HIV infection and progression to AIDS, especially among minority groups, is the lack of culturally sensitive and high-quality information about HIV risks and prevention of HIV, the socioeconomic status and persons having limited access to health care, the health beliefs concerning sexual practices, the roles of women, the value of children, and HIV treatment, and then the high cost of the HAART treatment that is used to treat HIV. Okay, the Healthy People 2020 goals related to HIV. First of all, to confine the annual incidence of diagnosed AIDS cases amongst adolescents and adults to no more than 12 per 100,000 population, and to increase years of healthy life of an individual infected by HIV by extending the interval of time between an initial diagnosis of HIV infection and the AIDS diagnosis, and between AIDS and the diagnosis and death. Goal 13 of the 2020 goals includes that the nurse or the healthcare provider include questions regarding sexual activity and the use of safer sex practices whenever obtaining a health history from all patients, to assess all patients for exposure to bloodborne or sexually transmitted infections, to encourage knowledge of the patient's own and his or her partner's HIV status, to encourage people who are HIV positive to avoid sharing toothbrushes, razors, or other items that could become contaminated with blood. Do not donate sperm, blood, plasma, or body organs or other body tissues. To inform all contacts with healthcare practitioners of their HIV status. To clean blood or body fluids, other body fluids on household or other surfaces with freshly diluted household bleach, 1 part bleach to 10 parts water. Also, another goal is to increase the years of healthy life of an individual infected with HIV by extending the intervals of time between an initial diagnosis of HIV infection and AIDS diagnosis and between AIDS diagnosis and death. The healthcare provider should teach HIV-positive people who have no signs or symptoms of immunodeficiency to seek regular medical evaluation and follow-up. Also, they should encourage HIV-positive people to adhere to a drug regimen, especially highly active antiretroviral therapy or HAART, to teach HIV-infected people to begin or maintain behaviors known to assist in maintaining or improving immune function, to encourage HIV-positive people to use safer sex practices, and to encourage HIV-positive women to avoid pregnancy. Okay, let's take a look at our first audience response question. Which statements regarding human immunodeficiency virus transmission is or are true? Select all that apply. 1. Breast milk can harbor the virus. 2. Proper use of personal protective equipment reduces the risk of disease transmission. 3. Needle exchange programs facilitate the spread of the virus. And 4. Needle stick injuries place health professionals at risk. So take a moment to just look at these answers and choose all that apply. Okay, we will look at the correct answers. The correct answers are breast milk can harbor the virus, number 1. And proper use of personal protective equipment reduces the risk of disease transmission, number 2. And finally, needle stick injuries place health professionals at risk, number 4. How is HIV diagnosed? There's several tests that are available. The rapid HIV test gives almost an immediate result as to whether or not the person is HIV positive. The enzyme-linked immunoassay or ELISA test also can give you a result of whether the patient has HIV or not. This test is probably about 99.9% accurate. So just to make sure that the positive result is indeed accurate, they do run a Western blot test as well. This test usually takes about 2 weeks for it to get the results back, so it's not as immediate as a rapid HIV test or the enzyme-linked immunosorbent assay, but it certainly is very accurate. Okay, as far as signs and symptoms of patients who have HIV, initially there may be no symptoms or they may have flu-like symptoms at the very beginning. In fact, the HIV test may be negative at this phase because the person hasn't developed any antibodies to the virus. As the immune system begins to fail, you'll notice that there are sentinel infections that occur, such as things like thrush or bacterial infections or fungal infections that the pathogen is normally available on the person, but because the immune system starts to fail, the patient starts developing infections to these normal flora that are on the skin, etc. AIDS will finally manifest itself with recurrent, severe, and life-threatening infections or opportunistic malignancies. AIDS is usually diagnosed when the CD4 count falls to 200 or less. They start treatment usually for HIV when the CD4 count is approximately 350. So before that, they may not necessarily even treat the patient, but instead try to bolster their immune system, etc. HIV infection, as the patient deteriorates, can be associated with dementia, can be associated with encephalopathy as well. There are neurological symptoms, not only because of the infections, but just as a general deterioration. And the HIV person can also experience wasting syndrome, HIV wasting syndrome, which is chronic diarrhea and weight loss with no identifiable cause. Here we see some examples of opportunistic infections that occur. They can occur, be a viral infections such as the herpes virus or the cytomegalovirus, hepatitis. They can exhibit bacterial infections like Mycobacterium tuberculosis and Mycobacterium avium complex. They can also develop cryptococcosis and candidiasis. The cryptococcosis is an infection that the patient can get an infection from the fungus that's in soil. It's often then found in the patient's lungs from inhaling, the dust, etc. And you also can have an impact on their CNS, their system. The candidiasis is the thrush or the yeast infections. The pneumocystis jirovecii is present in the environment, and when inhaled, if the CD4 count is less than 200, it can cause, a life-threatening pneumonia. Other parasitic infections, toxoplasmosis is contracted from activities such as cleaning kitty litter boxes. So we really encourage patients not to either have a cat, or if they're going to have a cat, that they not be the one responsible for cleaning the kitty litter box. And then cryptosporidiosis is a parasitic infection that can be gotten from drinking contaminated water. Other infections that can occur, well, not so much infections, I shouldn't say, but neoplasms that result because the immune system, there's no cell-mediated immune system, so to speak, really active any longer after the patient starts deteriorating. So they will develop what's called Kaposi sarcoma, which is kind of a skin cancer that can also travel inside and affect the patient's GI tract. And also patients with HIV and AIDS can develop lymphomas as well as a result of their condition. And then we talked about the neurological complications that occur with AIDS as well. Okay, what other things can we do as far as assessment goes when we're talking to a patient? The history that we take should address risk factors for possible exposure to HIV. These types of questions, such as unprotected sexual intercourse, especially anal intercourse, a large number of sexual partners, also a major risk factor. Do they have a previous or do they currently have a sexually transmitted disease? Do they share IV drug paraphernalia? Have they been a recipient of blood products before 1985 in the United States? Have they had mucosal contact with infected blood or a needle stick injury? Or is there a history of maternal HIV infection? Then we would do our focused assessment looking for signs and symptoms of opportunistic infections. Are they ill frequently? It would indicate that their immune system is deteriorating. We would look at, any signs and symptoms of skin cancers, any signs and symptoms of lymphoma. And then we would look at the psychosocial history of the patient as well. The psychosocial assessment would include a history of interpersonal relationships, their educational level, and their career information. We need to determine if the patient has told his family about his HIV status. On page 228, I believe, in the textbook, there are a lot of suggestions. It's table 11-6 that identifies many common patient and nursing problems that may be associated with systemic, psychosocial, or specific body system responses to HIV and or AIDS. Planning for our patient with HIV, we would plan to prevent secondary bacterial, viral, and fungus infections. We would prevent wasting due to malnutrition. We would try to maintain or improve the present level of the immune function, maintain adequate social functioning, and seek to maintain or improve current mental status. So in our plan, we would, of course, implement standard precautions to prevent spread of the disease. We would institute patient teaching. Again, if you look at page 228, that gives you some idea of what types of things you should address in your teaching plan. 228, 229, that area. We need to teach the patient how to control infection, especially in their home environment. And then we need to be alert for wasting syndrome. Again, wasting syndrome is losing more than 10% of their weight, along with at least 30 days of either diarrhea or weakness accompanied by fever. It's strongly correlated to the progression of the HIV disease and can lead to death. When we're looking at if our interventions are working, are they successful, we would collect data, and we would, of course, encourage the patient to seek out medical care and physical assessment at regular intervals. We need to include the patient and make sure that they're participating in their care and participating in their treatments. If we are giving them HAART medications and they're not taking them, or they're taking them sporadically and they're not taking them as they need to, we could run the risk of the virus becoming resistant to that type of treatment. So we definitely want to make sure that the patient's participating in their medical care. Is the patient and healthcare team members meeting expectations? And then monitor tests. We need to monitor their tests to determine their immune status. What is their viral count, their HIV viral load? What is their blood cell status? What is their CD4 count? And then what effects, if any, is the medication having on the patient in the treatment of their disease? Okay, other health issues. The HIV risk in the over 50 population, it seems like there's an increase in the occurrence of HIV because of lack of information being spread perhaps to that age group. They're not necessarily considered to be at risk. With the advent of, drugs such as Viagra, that type of thing, we're finding that older people are more sexually active than they had been before, so that again puts them at risk for HIV. Let's see here, community education and care are the people that are at most risk for HIV getting the education that they need. May not necessarily be occurring. The HIV confidentiality and disclosure, by law, we're not really able to share the information about whether or not a patient has HIV, but we strongly encourage the person themselves to disclose it to the individuals, close to them, family members, etc., so that they are aware, of the risks and that type of thing. When a nurse is HIV positive, that also needs to be taken into consideration as to what area that person would be able to work in. There is a risk, of course, of transmitting the virus to others, so there's a lot of questions ethically, morally, and legally about the responsibility to patients in that type of situation. The CDC and Occupational Safety and Health Agent or Administration, otherwise known as OSHA, They have developed evidence-based guidelines to prevent the exposure to blood and body fluids and other potentially infectious microorganisms to healthcare workers, as long as the healthcare workers have been educated and carry through with the same standards. They have found that if the healthcare worker correctly follows the guidelines, the risk of being exposed is markedly reduced.